Hi, it's Christina with the Sisyphean Journal. We are on the last part of Chapter 1 of Line 5, the book I helped to write when I was at Life Dynamics in Denton, Texas. And today we are looking at Disseminated Intravascular Coagulopathy, which DIC, it's a clotting disorder. My understanding is that there are two kinds of DIC. One is where the blood just clots too much, and the other is when the blood won't clot at all. All of the women in this section had the kind where the blood just wouldn't clot. And all of the women in this section did end up dying. I do have them all on the cemetery of choice. And if you follow the link to the companion post, if I have all the original source documents I need, I don't list them after that woman's paragraph. But if I do need copies of the original documents, I note what I need in the post. So the first woman was Vanessa Preston, a 22-year-old daycare worker who went with her husband to Curtis Boyd's Fairmont Center in Dallas on January 22nd of 1980 for a 16-week abortion. Now, I am going to note that this does really appear to be one of those all surgery has risks, because I can't, assuming that they meant well doing the abortion, that, Boyd wasn't just being a greedy bastard selling abortions, assuming he meant well to do the abortion, I really can't find any fault with them. His treatment of Vanessa seemed appropriate from beginning to end. So during the abortion, Vanessa did suffer some vaginal punctures, which is not the kind of injury likely to prove fatal. But before Curtis Boyd could remove the placenta, Vanessa went into a grand mal seizure and then into cardiac arrest. Now, they had emergency procedures in their book. They followed through on all their emergency procedures. They called the ambulance. They made appropriate and effective efforts at resuscitation while waiting for EMS. She was taken to the hospital. Doctors were performing exploratory surgery. They administered 24 units of blood trying to keep her circulatory system from collapsing. But nevertheless, Vanessa died. And an autopsy revealed that her uncontrollable bleeding had been caused by an amniotic fluid embolism triggering the coagulopathy. And she had bled to death from a very small laceration of her liver caused while someone was performing CPR. And even in properly performed CPR, it is not at all uncommon to lacerate the liver. So again, this isn't a sign that they did anything wrong. In fact, they were probably performing the chest compressions properly if they were performing them deeply enough to break a rib and lacerate her liver. So it's very sad, but this is the one case where it really does seem to be an all surgery has risks. Barbara Auerbach was 38 years old when she underwent an abortion in a New York hospital on December 11th of 1981. In the early morning hours, 5 days after her abortion, she was admitted to another hospital with intermittent vomiting, back pain, and the inability to pass urine. She was diagnosed with septic shock, acute renal failure, and DIC. She had pelvic adhesions, an enlarged uterus, 1,000 cc's of gray fluid in her peritoneal cavity, and a hardened, twisted, yellowish-brown obstruction of her small bowel. Her entire small intestine had markedly dilated and inflamed loops, and her lungs contained excessive pinkish watery fluid. She was pronounced dead at 11:35 a.m. And it was actually the infection rather than the DIC that killed her, so I'm really uncertain why Mark put Barbara in this category, but Mark does what Mark does. Then we have Dawn Mendoza. She was a 28-year-old mother of two from the Bronx. She underwent an abortion at the hands of Edward Rubin at Women's Medical Pavilion in Dobbs Ferry, New York on June 29, 1988. Her brother, who had accompanied her, was told to wait in a grassy park across the street from the clinic and to return at 4 p.m. to take her home. When he got back, the staff told him to come back later. He returned at 5:30, and they told him his sister was dead. Reuben had performed a D&C abortion on Dawn, who then started screaming and gasping for breath. Staff tried unsuccessfully to revive her, but she died without even being transferred to a hospital. She'd actually died from an amniotic fluid embolism, so why Mark put her in this section, I do not know. Next, we come to the death of Marla Cardamone, and some of what I know about this is from personal communication with her mother, Deborah. Deborah said, the last 2 weeks of her life, all she did was cry. Marla did not want this abortion. She was 18 years old. She wanted to have her baby, but a social worker at McGee Women's Hospital in Pittsburgh insisted that Marla needed to abort this baby, saying that her mental health medications had caused severe disabilities. Marla said she'd placed the baby for adoption. The social worker said nobody's going to adopt a baby that's severely disabled. And, what are you going to do? Are you going to bring this baby home with your mom already having to take care of your quadriplegic father and help you take care of a toddler? How can you do this to your family? So Marla asked for an ultrasound, but nobody ever reviewed the results of the ultrasound with her. Finally, after all the badgering, Marla did check into McGee Women's Hospital for the abortion on August 15th of 1989. The doctor, Michael Weinberger, used the urea induction technique, which involved injecting a chemical into the uterus. And this was an antiquated and dangerous method. So why at a high-end women's hospital he decided to do this remains a mystery. Either an error during the injection or some other mishap caused Marla's uterus to start going necrotic. And the laminaria he used to dilate Marla's cervix had also started bringing infection into her uterus through the cervix. Marla's kidneys shut down. She became obviously ill during the night with nausea, vomiting, urinary incontinence, and dried blood on her teeth. Her pulse and temperature were severely elevated. At 6 a.m., the charge nurse contacted the first of several doctors to treat Marla, but there were no cultures taken. By 7 a.m., she was increasingly disoriented and speaking inappropriately. By 7:15, her blood pressure had fallen to 80/40 and her pulse had shot up to 144. She was unresponsive, grunting loudly, and having seizures. At 10 a.m., they finally got around to intravenous antibiotics, but that was going to do nothing to address the kidney failure or the necrotic tissue in her uterus. Marla died from septicemia at 12:15 p.m. The autopsy and the ultrasound both showed that there had been nothing wrong with Marla's baby. Then we go to National Abortion Federation member Abu, the butcher of Avenue A, Hyatt. Charming man. On September 17th of 1990, 17-year-old Sophie McCoy went to his office accompanied by her mother and the husband of another facility that referred them. Sophie and her mother returned the next day to Hyatt's office and paid for the abortion. He gives Sophie intravenous medications to put her to sleep. She was kept for about 4 hours and discharged with another prescription for antibiotics. That evening, Sophie was bleeding, having abdominal pain, and having difficulty breathing. The next day, she was really struggling to breathe, so her mother took her to Kings County Medical Center. Sophie was admitted reporting vaginal bleeding, chest pain, and shortness of breath. The doctor who treated her discovered that she had a perforated uterus and sepsis. They performed an emergency hysterectomy, but Sophie developed DIC and septic shock, and she died on September 26, leaving her 1-year-old son motherless. Hyatt, National Abortion Federation member, is also the baby who tore the arm off the as-yet unborn Ana Rosa Rodriguez during an abortion attempt. This 32-week baby was born maimed in a hospital the following day. Then we have Angel Darty, 22 years old. She left 2 children motherless when she died on August 3rd, 1982 of DIC after a safe legal abortion performed by Yule Choi at Plymouth General Hospital near Detroit. Choi performed this a risky procedure, saline abortion. And after Angel died, her mother sued, but she got a meager settlement of $6,000 from Choi and $2,500 from the hospital. Roughly half of that was eaten up with legal fees and funeral expenses. And Choi is also the one who performed the abortion that left Nina Gaston comatose for 16 years before her death in 2004. And the last death in this section is Rhonda Rawlinson. She was 32 when she had a safe legal abortion performed by Dr. J. Levine at Malcolm Paulus's Philadelphia Women's Center on September 3rd of 1992. The abortion attempt was unsuccessful. Levin sent Rhonda home with instructions to return on September 12th to try again. But she experienced such severe pain, dizziness, fever, and discharge that on September 10th she sought emergency care at a hospital. She was suffering severe non-cardiogenic pulmonary edema consistent with adult respiratory distress syndrome. Doctors did a laparoscopy, a dilation and evacuation, an abdominal hysterectomy, and a splenectomy, all to no avail. Rhonda died on September 14th. The autopsy revealed a perforation from her vagina into the uterine cavity, sepsis, DIC, non-bacterial thrombotic endocarditis, pulmonary infarctions, and dysplastic kidney. So this is the end of Chapter 1 of Line 5, where we look at abortion injuries and deaths. Next comes SAs, a different kind of badness that women are, of course, going to be particularly vulnerable to if they are undressed, lying on a table, sedated with their legs spread. You conclude for yourself what that is.